Hello and welcome. Today we are talking about an important topic that affects millions of families around the world, Alzheimer's disease. Many people believe memory loss is simply a normal part of aging, but sometimes subtle changes in memory, thinking, and behavior may signal something more serious. In this video, we will discuss the early signs of Alzheimer's disease, who is at risk, how it is diagnosed, and what you should do if you notice these symptoms. Stay with me until the end, because early detection can make a major difference in care and quality of life. What is Alzheimer's disease? Alzheimer's disease is a progressive neurological disorder that slowly destroys memory, thinking ability, and eventually the ability to carry out everyday tasks. It is the most common cause of dementia, accounting for approximately 60 to 80% of dementia cases worldwide. Inside the brain, abnormal proteins form amyloid plaques and tau tangles, which damage brain cells and disrupt communication between neurons. Over time, this leads to the gradual loss of cognitive function. The disease usually develops slowly and may begin years before symptoms become obvious. Why early recognition matters. Recognizing early symptoms is extremely important. Early diagnosis can allow patients to receive treatment sooner, help families plan future care, improve safety and quality of life, allow participation in clinical trials, address reversible causes of memory loss. Many conditions can mimic Alzheimer's, including vitamin deficiencies, depression, thyroid disorders, or medication side effects. This is why medical evaluation is essential. Early signs of Alzheimer's. Let's now look at the early warning signs that should never be ignored. 1. Memory loss that disrupts daily life. One of the earliest symptoms is frequent memory loss, especially forgetting recently learned information. Examples include repeatedly asking the same questions, forgetting recent conversations, relying heavily on reminders or notes, forgetting important dates or events. Occasional forgetfulness can happen to anyone, but persistent memory problems deserve attention. 2. Difficulty planning or solving problems. People with early Alzheimer's may struggle with tasks that require concentration or planning. Examples include difficulty managing finances, trouble following a familiar recipe, taking much longer to complete routine tasks. These changes may appear subtle at first, but gradually become more noticeable. 3. Trouble completing familiar tasks. A person may suddenly find it difficult to perform tasks they previously handled with ease. Examples include getting confused while driving to a familiar location, difficulty operating household appliances, trouble organizing daily activities. These difficulties may cause frustration and anxiety. 4. Confusion about time or place. Another early sign is disorientation. A person may lose track of dates or seasons, forget where they are, become confused about how they arrived somewhere. They may also struggle to understand events that are not happening immediately. 5. Problems with language or communication. Language difficulties are also common in early Alzheimer's. Individuals may struggle to find the right words, pause frequently during conversations, repeat themselves, have trouble following discussions. Sometimes they may stop speaking mid-sentence because they cannot remember the next word. 6. Misplacing things and losing the ability to retrace steps. People with Alzheimer's may place objects in unusual places. For example, putting keys in the refrigerator, leaving a wallet in the bathroom, accusing others of stealing items. They often cannot retrace their steps to locate the missing object. 7. Poor judgment or decision-making. Changes in judgment may appear early in the disease. Examples include giving away large amounts of money, falling for scams more easily, neglecting personal hygiene, making unsafe decisions. Family members may notice these changes before the patient does. 8. Withdrawal from social activities. People may begin to withdraw from hobbies, work, or social events. This may happen because they feel embarrassed about memory problems. Conversations become difficult. They feel overwhelmed in group settings. Social withdrawal can worsen isolation and emotional distress. 9. Changes in mood or personality. Alzheimer's disease can cause significant personality changes. Individuals may become more anxious, easily irritated, suspicious of others, depressed, fearful in unfamiliar environments. These emotional changes may appear before severe memory loss develops. 10. Difficulty with visual and spatial abilities. Some individuals experience problems judging distance or recognizing objects. Examples include difficulty reading, trouble driving, misjudging steps or curbs, problems recognizing faces. These symptoms are sometimes mistaken for vision problems, but may actually be related to brain changes. Who is at risk? Several factors increase the risk of developing Alzheimer's disease. The most important risk factor is age, especially after age 65. Other risk factors include family history of Alzheimer's, genetic factors, cardiovascular disease, diabetes, high blood pressure, smoking, physical inactivity. Research also shows that brain health is closely linked to heart health. How Alzheimer's is diagnosed. There is no single test that confirms Alzheimer's disease. Doctors typically perform several evaluations, including detailed medical history, cognitive testing, neurological examination, blood tests to rule out other causes, brain imaging such as MRI or CT scans. In some cases, specialized tests may detect amyloid or TIU proteins in the brain. Early diagnosis helps guide treatment and care planning. Treatment and management. Currently, there is no cure for Alzheimer's disease, but treatments can help manage symptoms. Medications may help improve memory and thinking temporarily. Lifestyle changes may also help support brain health, including regular physical activity, healthy diet, mental stimulation, good sleep, social engagement. Managing chronic diseases such as hypertension and diabetes is also important. When to see a doctor. If you or a loved one notice persistent changes in memory, thinking, or behavior, it is important to seek medical evaluation. Early assessment can determine whether symptoms are caused by Alzheimer's disease or another treatable condition. Conclusion. Alzheimer's disease is a serious condition, but recognizing the early warning signs can make a significant difference. Symptoms such as memory loss, confusion, language problems, and personality changes should never be ignored. Early medical evaluation provides the best opportunity for treatment, support, and planning for the future. This video is for educational purposes only and should not replace professional medical advice. Always consult a qualified healthcare professional regarding any medical concerns. If you found this video helpful, please like, subscribe, and share to help spread awareness about brain health. Thank you for watching.